Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we have Julie on hold. And what else is going on, Dr. Darrow?
I'm going to give out the phone number right now so you can talk to me. Julie, hang with us just one more second. The number to talk is 866-870-5752. That's 866-870-5752. I'd love to talk to you here about your musculoskeletal pain and how we use stem cells and platelets. Will be very interesting to teach you and your doctor how to avoid unneeded surgeries. Also, if you want to call the office, the phone number there is 800-300-9300. That's 800-300-9300. And if you want to watch me doing procedures, give us a shout on the internet at www.jointrehab.com. www.jointrehab.com. So, Julie, you're back with us?
Yeah. Yes, he's here. Just a moment.
Yeah, hi, this is Mike Gentry. I'm glad I got you on the phone. I've heard you many times.
Oh, good.
I'm thinking, I'm sure my insurance doesn't cover it, but I'm wondering what it would cost you to take a look at my shoulders and my two knees. I'm 78 years old, and boy, I just can't quite run as far as I used to. And I think I need to be looked at, and maybe you can stick a needle in me and put some of that stuff that the other doctors are afraid to use.
Well,
and it works.
Thanks so much, Mike.
I believe in alternative medicine.
Let me ask you some questions first, Mike. How long have your knees bothered you?
Where is he?
Mike, can you hear me?
Oh, I didn't hear. How do you get this thing up where you can hear it, honey?
Oh, my gosh.
Oh, I got to stick it to my ear. Okay, I've got it on my ear. I'm sorry.
Mike, you're giving us a good time here. So, Mike, how long have your knees bothered you?
Oh, I'd say a year or two.
Okay.
I've already had one surgery where they stuck 3 stents into my arteries right near my heart.
Okay. Well, we're not.
Yeah, I didn't eat the right stuff for many years.
Mike, we're not dealing with your heart. We're dealing with your knees and your shoulders. And what?
Yeah, I know. I'm just telling you that in case you didn't want to. You probably want to say, "Oh, wait a minute, I don't want to get near this guy. He's falling apart."
No, we love you, Mike. Don't worry. How long have your shoulders bothered you?
Oh, my shoulders. It only gets. Sometimes it gets a bit of pain. It's pretty good, and I can lift my arms up pretty high, but not as high as I used to. I did have, about 30 years ago, a doctor shot me with that cortisone crap, and I couldn't even hardly get my arm out at more than about 45 degrees at the time.
Well, look.
And it did work as far as it solved the problem within a day or so.
Well, it solved.
So I've gone for 30 years.
Mike, you got to listen too, okay? It solved the problem.
Yeah.
But that's winning the battle and losing the war, because what it does, the cortisone actually softens up the tissue and can destroy the cartilage that's in there. So stay away from that in the future if you can help it. I know it feels good.
I haven't been back to anybody.
Okay.
I thought I ought to come back to you, but I just want to know, because I know I'm going to have to dig
my turn, Mike.
Huh?
It's my turn.
Oh, okay.
All right, so you haven't seen a doctor in a while. You need to come in, let me examine you, see what's going on, and the same thing with your knees.
Yeah.
I understand that your wife has to yell at you to shuffle along faster. So I think there's help. I think there's help ahead for you. I just I don't know enough about you or your condition yet to tell you. So you need an examination. And for you, the best thing to do is just call the office at 800-300-9300 and come on in, and we'll do a quick exam, and then I can talk more. Right now, there's nothing really more to tell you other than regenerative medicine using stem cells and platelets most likely is going to help you. I mean, it doesn't sound like there's anything terrible going on. Okay? So that's it.
Yeah,
That's it for
not.
you and me, Mike. God bless you. It's nice talking
Thanks
to
for your call, Mike. Appreciate it. And thank you, Julie, too. Okay, so what next, Dr. Darrow?
you. Well, questions. Questions are always the best way to go here.
Do you want to give the phone number and the website and stuff like that?
No, I don't, but thank you for the offering.
Do you want me to?
No, I'm kidding.
Oh, okay.
Yeah, the number to talk to me is 866-870-5752. And the website, www.jointrehab.com. Now, I want to go to a question right now, Anita. I like this one.
Go for it.
It says,
Okay.
Morton's neuroma.
Ooh, what's that?
Well, let's talk about what that means. Morton is a doctor's name, and neuroma is a bundle of nerves. Where this ends up is in the toes. And very often people have a surgery to cut out a nerve bundle there that is not causing the pain. Okay? So that's typical of the work that I do, is fixing these kinds of things. And it's typical that it's the wrong diagnosis that people end up having surgery for. So if you have pain at the bottom of your feet where the toes attach to the bottom of the foot, and someone says that's a Morton's neuroma that's causing it, most of the time they are wrong. And you will end up getting a surgery you didn't need, and you will end up having more pain afterwards, potentially. So what I do there is I use platelets from the blood or stem cells, and I inject that area. Most likely it's something different called a metatarsalgia. It's where the metatarsal bones attach to the toes. And it's just wear and tear. Sometimes people who are too overweight will have that. Some people are too active will have it. Oftentimes I'll make some orthotics that take the pressure off of that area, and that'll get rid of it. I had it, and I built myself some orthotics with a little pad there, and that helped me. So those can be fixed using regenerative medicine, platelets and stem cells. And please don't get a surgery, don't get steroid shots there. Do it the way that works naturally, get it fixed. And the way that fixes things that I've seen for the last 25 years is by injecting substances that regrow the tissue and rejuvenate it. So if you've got a Morton's neuroma or anything else around the body that hurts, check it out. Stay away. Well, you can go see a surgeon. I actually do send people to surgeons for a second opinion. Unfortunately, what I usually hear is they need surgery. So it's the old idea: if you've got, what does it need? What is it?
Well, you have to really be careful and get opinions, but do the least invasive thing first.
But there's a funny saying: if you've got a hammer, or if you've got a nail, you're going to use. I don't know.
It's not before my time, I think.
Nita, come on. You're at least 1 minute older than me. If you've got a hammer, you're going to use it on the nail. But the point is, you don't need to use the hammer. In this sense, the analogy is getting a surgery that's invasive when you can heal this with some simple injections. So one more question here. Let's see. Hip, here we go. I've got all kinds of knee questions here, but here's a hip question. And by the way, the regenerative medicine using stem cells or platelets works pretty much anywhere on the body. It's not limited to certain joints. There are certain doctors that will do it only on the joints. I do it all over the body. And I find that it works on muscle tears, ligament strains. A lot of people just come in and they have what's called an enthesopathy. And they'll get diagnosed with degenerative disc disease, spinal stenosis, something like that, a disc herniation. Well, that's not even the problem. It's just that the ligaments that hold the bones together have been worn down or stretched out, and it's so easy to inject those and thicken them up and tighten them up and heal it. So this is a very simple question. I have hip and knee pain. Can regenerative medicine help me? Yes, of course. That's what we do all day long. Make sure if you're doing a hip or a knee or a shoulder, you have a doctor that's using an ultrasound to look inside, because you can't get that little needle to the right spot without an ultrasound. There are doctors who use steroids all the time that spread out all over. He hasn't even injected the right area, but the steroid spreads out, strong anti-inflammatory. The patient feels better for a while. And I think I've told the story before, Nita. I had tennis elbow, and I had a couple of steroid shots. This is back in my lawyer days when I was practicing law, and I didn't know much about medicine. And the first steroid shot worked great. And I went out and played tennis, and it got worse. I came back, got another steroid shot, cortisone. Worked great. Played tennis, came back. And then it got really bad. So I learned about, later down the road, I learned about regenerative medicine after I went to med school. And I injected my own elbow. Actually, both of them were having problems, and healed them both up. So the hip joint, as this is about here, is very difficult to get into without an ultrasound. If you're not looking at where that needle is going, you're going to miss that joint. And for many, many years, we were injecting them without ultrasound guidance because we didn't know about it. And we'd always talk, us practitioners that do this work would get together and query, how come hips don't heal when every other joint in the body heals? And the reason is it's a deep joint, and you need to be able to observe it and look at it live and watch where that needle goes to get that solution into the joint. It's a teeny little spot, and guessing where it is doesn't help. Okay? Nita, I hear you smacking your lips. You got some information?
Yeah, I just...
Nan, you want me to talk to Nan?
To Arizona.
I do, Nan. How are you today? You got knees and hips. Boy, there's a lot of knees and hips today.
Good.
Oh, okay. What's going on?
Well, I'm trying to be proactive. I've had both hips replaced, and they're great, and my knee, and I went through all the meniscus and the steroid and then the knee replacement. But the funny thing is that was the right knee, and my left knee on the x-ray looked just as ugly as the right one.
Yep.
But my left knee got perfect after my right knee surgery.
Well, that makes some sense, because while you're one of your knees was hurting, you're probably favoring the other one and wearing it down.
And the other one probably would have healed, but I had what turned out to be a herniated disc in my back, but it was manifesting in my thigh and right above my knee.
Okay.
And, but my question is there something I can do to be proactive? Because I'm a very active person, and I'm hard on these new joints and old ones.
Okay.
Would stem cell injections help at this point when I'm feeling good, or do I wait until something breaks? Or
well, there are people that actually do stem cells on their entire body. Not many, but I have done it a few times. And there's a friend of mine who does it frequently. He advertises for that. And it's not something that I promulgate unless a person's got a lot of pain all over the place. Because, my mom was a very smart woman, and she used to always tell me, if it ain't broken, don't fix it. So can you do something prophylactically? You can. And if you were a high-impact athlete and you had one knee bothering you, you can expect the other one at some point might, start bothering you also. So you might do both.
Well, they both were bothering me, and I did the meniscus surgery, which I hear doesn't really do anything.
Well, you know what's weird, Nan? This is so weird. There are studies that show that a fake meniscus surgery works as good as a real surgery.
I've heard that, probably from you.
Well, I mean, I can get you the research. If you ever want to, if you're ever interested, you can just email me through my website at www.jointrehab.com, and you can ask me for studies on things. I'll send them to you. Yeah, I mean, there's studies on the knees that show that you're really better off not getting the surgery, because if it's going to come out the same with the surgery as without the surgery, why would you do a surgery when you get an infection or end up with arthritis right away? Surgeries cause arthritis. They do these clean-out surgeries where they take tissue out, and that's immediate arthritis. You've got arthritis after that. So I'm not a fan of that. How many surgeries have you had? This sounds like a lot.
Right knee and both hips have
Okay.
been, complete replacement.
And then did you get a back surgery too?
I got just one injection of whatever they did because they said it was inflamed.
Okay,
And
so you probably did you have an epidural? Was it called that?
yes,
Okay, and that worked to get rid of the pain down your thigh?
it did, and it's been since November of 2019.
Okay.
It worked immediately,
Okay.
and I'm still good. And I
What does immediate mean? Was it 1 minute
Like
or is it
the
2
next
days?
day.
Okay. So let me tell you something that's going to freak you out.
okay.
So they gave you an injection in your back, and it got rid of that pain around your knee and your anterior thigh,
Yes,
right?
my thigh, basically. Yes.
The front of your thigh.
And by the way, that was the worst pain I have ever had. There was not one position
Okay.
I could get in that it didn't.
Do
just
you remember?
feel like
Do you remember
fire.
what level it was herniated? L3, 4, 5, S1.
5.
Okay.
I think 4 or 5.
Okay. And was the pain you were having on the anterior or the front part of your thigh, or on the back part where your hamstrings are?
Mostly in the front.
Okay. Now I'm going to tell you my theory, and I could be wrong. That's typically L3, which is higher than you had the herniation. And my guess.
And it might have been 3.
Okay, but let me tell you my guess.
They told me one thing,
Okay.
but go ahead.
My guess is that you had a big dose of a steroid, and it's a strong anti-inflammatory all over the body. And it wasn't where they placed it that got rid of that pain.
Oh.
I'm not saying this is the truth. I'm just saying it's my guess.
Mm-hmm.
It's the same as if you had that shot in your arm or in your back or your neck or your toe. A big dose of a steroid is going to get rid of pain most likely all over the body.
So maybe that's why my left knee got better, too.
That's what I am saying. So I'm not a huge believer in epidurals either. The studies show that they don't really work. So it may be a short-term help, but I'm into not winning the battle. I'm into winning the war. And winning the war means healing the area naturally. So
and what would help a herniated disc?
I'm thinking it's not the herniated disc that's causing your problem.
Oh, I see.
It's
Okay.
possible, but I'm thinking no. I'm always thinking outside the box because I don't want to do things to patients that are not really getting to the cause of the issue of the pain. And I would have to examine you. And had you been tender where that pain was around the knee, did you ever press it and it hurt, or the pain would go away when you press on it?
Nothing made that pain go away. Not pain pills, not heat, and no position.
Okay.
I mean, I've had other things where at least you can lay down and it goes away.
Well, the first,
but that was
again,
worse.
we can't go backwards in time, and I can't tell you for sure what happened.
Sure, right.
But I get this all the time where people come in, they go, I've got a herniated disc, I've got degenerative disc disease, I've got Facet syndrome, blah, blah, blah. And I examine them, and that's not where the pain is coming from. So anyway, doctors have to be smart, and my point of view is they have to be trained in examination skills, and most of them don't do that. Some do. Some are great practitioners and do examinations, but unfortunately I get a lot of failed surgeries come in the office, and I always ask the question, did the doctor touch your body? And the answer is almost every single time, no, they didn't. They looked
right, and I would agree with that. I just have been fortunate that apparently the surgeries worked. My knee is somewhat stiff, but it's not painful, and it works.
See, again, Nan, I'm going to take issue with the word worked.
Okay, gotcha.
Yeah, if you can do something conservatively by getting injections of stem cells or platelets and heal something, and that can do it, and it's very easy, why would you even consider getting a surgery to do it and taking and amputating bone and putting in fake stuff? I would never want to do that.
We do it because of the insurance and the money. I think that's what happens.
Well, it's our culture. The culture is to do surgery. It's changing. The culture is changing. The research is getting out there. The research shows don't do the surgeries, do regenerative medicine. And Google is showing people, if you look up, as example, if you Google cortisone and cartilage, you'll never get another cortisone shot. And if you read about, and it's all in my book, which we're going to send you for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I've got all the research in there showing that surgery is not the best way to go. It doesn't mean you can't do a surgery, and it doesn't mean you might need a surgery, because you might. But most of the cases I see that people have had surgeries, they shouldn't have had them done in the first place.
Makes sense, yeah.
You didn't love getting your joints replaced.
No, I didn't. We can talk about it. It's a good conversation piece for other people.
Yeah,
That's
and then
about it.
There's a lot of. I don't want to give you negative thinking about what's been done, but there's a lot of issues that can come up later, and I don't even want to go into them with you. I just want you to be happy and know that you've done what's done, and you move on and stay active. But I would say in the future, because you're an active person, you're going to hurt yourself again. That's part of life if you're very active. Think about doing regenerative medicine of platelets and stem cells first.
I'm going to, definitely. That's why I'm calling. One other question, that these metal parts that I have, I read about cobalt and whatever, metal that's in our bodies that sloughs off. Is that...
Well, I have had tons of people over the years that have come in where they've had to have their prosthesis removed for many reasons. One is it can be an allergy to whatever was put in, and other is that it can loosen up over time. It wears the bone out. But there's one.
Have they done better with the actual metal and ceramic and whatever they're using in terms of?
I've seen problems with all types. But that doesn't mean you ever will have one, and God bless you, and I hope you never do.
Thank you.
Yeah.
Well, I water ski competitively, and I play pickleball every day.
Oh, good.
I'm able to run again in softball, so I'm just pushing the envelope, I guess. And
well, one thing you have to, I'm going to tell you one thing you do have to remember. When you have a joint replacement and you overuse that joint, it's going to wear out, and then you're in a big problem.
Okay.
So you may be pain-free at this point, but if it were my body and I had to have a joint replacement, I would take care of that joint.
Mm-hmm.
Because it has a useful life, and then boom, then what are you going to do?
Mm-hmm. I don't know.
Well, I don't know either.
The stem cell injection.
No, that's it's too late,
point?
because if the bone is worn away from you being overly active, they're going to want to take it out and put in a bigger one, and that can crack the bone that's there. I've seen that happen too.
Yeah.
So I wouldn't go gung-ho the way you were when you were younger after those joint replacements.
Okay.
I mean, I'm saying if it were me, you do what you want.
Right.
I always tell people, say, what should I do? And I go, I'm not going to tell you what to do because it's your body and it's your life. I say, if it's me, I'm going to take care of that. I'm going to baby it.
How long do these replacements last, these newer ones? I guess
I don't have an
oldest
answer.
one is 2016.
I don't have an answer for you. It's different. Everybody's different. And people always say to me, well, I guess they're not going to say anything because it's the end of the show. God bless you. And if you want to reach me, personally, go to my website, www.jointrehab.com. Jointrehab.com.
Okay.
You can email me from any page there. God bless you all. The office number is 800-300-9300. God bless everyone. Thank you, Nita.
Thank you. Thank you, Spencer. Suzette, remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life. Call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.